Greetings, I'm Dr. Kim Yong-jin. Welcome to online surgery case briefing. This is 57-year-old female patient. There's no specific systemic problem as shown in the panoramic image. There's very severe periodontal disease in the residual teeth and a few of them show root rest. This is at initial visit. Due to very severe periodontal disease, there is very severe mobility in the anterior bridge and pathologic movement can be observed in the lower residual teeth. There's no bite in the posterior area, so there is a deep bite in the anterior area. The plan was to remove all residual teeth in the upper and lower and to restore with implant. The patient wanted fixed prosthesis, so multiple implants were planned. In order to get ideal positioning, I decided to use the OneGuide system. Although there are residual teeth, because there is severe mobility, you cannot use it for merging point for digital guided surgery. I normally place 3 or 4 orthodontic screws and add resin balls on top of it, and merging was done in the same way for upper and lower as shown. The resin ball serves as the roll of teeth and therefore the quality of merging is very good. Merging has been done very nicely for both upper and lower. After that, I have designed the prosthesis for the upper and lower. For the upper, the patient was going to use temporary denture, and for the lower, prefabricated bridge was going to be used for immediate loading after implant placement using OneGuide. I anticipated that it was going to take more time for loading on the upper after implant placement, therefore implant was placed first in the upper. First, let's look at the upper. 9 implants were planned. Let's look at the surgical plan. On both sides, the lateral approach was going to be used for sinus bone grafting, and to place the implant in ideal position, OneGuide template was used to place the 9 implants. After that, in the anterior region, you can see a lot of vertical bone defect due to severe periodontal disease, and Ostem's Osbuilder was used for GBR. Contouring augmentation was done in the anterior area as well. Surgery for the upper was done in Ostem Meeting Life Surgery in China. This is the result. As anticipated, implant has been placed nicely in the anterior area. Osbuilder was used for GBR. In order to have a bit of soft tissue healing, I waited for about a month. And this is healing after 1 month. Healing is nicely done in the upper. Extraction of teeth with high mobility in the lower were extracted. Number 4 on both sides were left alone and surgical plan was made after surgery on the maxilla after 1 month. This is the image. The things you should note in today's online surgery is as shown. The vertical dimension on right and left is very different. This may result due to many reasons. Maybe extraction was done in different time point, and due to a certain cause, alveolar bone can be extruded. In this case, even if you place the implant well in the bone, VD, if it is lacking, it is difficult to make crown or prosthesis. Therefore, vertical reduction was planned. Focus on this point. Today, this is the surgical plan. Number 34 and 44 were planned for extraction. OneGuide template is going to be used and fixed. 8 implants are going to be placed. 46 and 47, as shown in the panoramic image, alveolar bone is extruded significantly. Drilling is going to be done, and then grinding is going to be done after reflecting flap. After that, depending on the drill position, implant is going to be placed. 2 implants are going to be placed after removing OneGuide template. Using the prefabricated prosthesis, immediate loading is going to be done. 10-unit PMMA bridge from number 5 to 5 has been fabricated. If you look at the plan using OneGuide in number 37 and 36, 5.0 diameter was planned. When you look at the plan using OneGuide, you should not only focus on where implants should be placed, but on the bone quality as well. As shown in number 37, the crastocortical bone is very thin, and below the cancellous bone's density is very unfavorable. I thought I would not be able to get good primary stability, and if primary stability is not good, I'm going to change to bigger diameter implant. Number 35 and 34, there's not going to be a major issue. This is number 33 and number 43, and this is for number 44 and 45. Unlike a premolar and canine area, 47 and 46, the bone quality looks very bad. Number 46, it doesn't look very bad, but number 47, it looks very unfavorable. Even if it's a lower molar, if it does not get functional load from antagonist, the alveolar bone as well as the trabecular bone becomes resorbed. I anticipate very soft bone, especially in the case of number 47 and 46. I'm going to do vertical grading. Crastocortical bone, which the implant engages, is going to be lost completely, and therefore stability is not going to be good. And I hope you take note of how to respond to these situations. This is the guided design. 4 anchor pins are going to be used for fixation. In the case of lower alveolar ridge, where we get support, is very narrow, and due to tongue movement, the surgical stance stability is going to drop, and therefore I try to use as much anchor pin in the anterior and posterior area. Let's look at the surgical clip.
아시겠어요? 위에가 가방 양쪽 다 작성을 했습니다.
네, 작성하겠습니다.
이렇게
네, 선택 한번 더
이거는 탈점을
해보세요.
됐고. 아프세요? 괜찮으시죠?
오빠 원래 팔 떴는데
이제요?
이게 뭐야? 10. 네, 5월 10이요?
이게 7.
이게 7이요? 네. 이게 7이요? 이게 7이요?
정기적인 문제죠?
네. 렌즈 좀 하실 거예요.
자, 이제 수술
You have watched the surgical clip. This is the post-op panoramic image. 10 implants have been placed as planned, number 4 and number 5 on both sides. Transfer abutment and prefabricated PMMA bridge have been used for immediate loading.
시행을 했습니다.
As shown, when we first planned, I planned for placing 5.0 by 8.5 implant on number 7 on both sides. However, after surgery, you can see that on the right side, 7.0 diameter implant is placed, and on the left, number 37, 6.0 diameter implant was placed. As shown in the clip, if you place a 5.0 implant and if stability is not good, you can change immediately to ultra wide diameter 6.0 or 7.0, and that'll lead to better results. This was how it was placed.
거고요. 한번
This is follow-up image at 4 weeks. In the lower, the patient is using prefabricated PMMA bridge, and in the upper, the patient is using complete denture as temporary restoration. Pre-op, if you look at lower right, the vertical dimension is very lacking. Grinding has been done sufficiently. VD looks sufficient for prosthetic restoration.
확보가 된 걸 보실 수 있습니다.
On number 37, the vertical dimension seems lacking comparatively. In secondary surgery, you can grind ramus distal to number 37. This is follow-up at 8th week. Occlusion is well maintained. The newly formed vertical dimension, the patient has become accustomed to it and is masticating well.
영상을 보실 수 있습니다.
At 8th week follow-up, overall cleaning was done.
뒤쪽에
Healing abutment was not connected on the posterior area and primary stability was not good. Cover screw was connected in number 6 and 7 on both sides. The soft tissue healing is done nicely. This is lateral view as shown. If you look at posterior area of left and right, on the right side where grinding was done, it looks okay. However, on the left, especially in number 7, because of ramus, vertical dimension seems to be lacking. This will be addressed later in a simple manner.
하게 해결을 하도록 할 계획입니다.
Thank you for watching.